Hello, everyone, and thank you for joining us today. My name is Dustin Burson, and I'm joined today with my colleague Nate Malubay, and we'll be talking about unlocking IoT data for research in healthcare. To start with, I'll go over the brief session outline. So we're going to cover IoT in healthcare, go through some of the challenges you might face if you're using IoT with healthcare data, and then we're going to cover what we have done so far in the Health Cloud and Data team to solve these problems. And then later, Nate's going to be going over several examples on how you can use IoT data and some of the technologies we developed through an end-to-end solution. So to start with, what is IoT in healthcare, or as we call it, IOMT? Well, IoT stands for Internet of Medical Things. So you can think of this as a subset of medical devices that deal with specifically patient data. They can come in many shapes and sizes. They can be worn, so a lot of you be familiar with devices like Fitbit and Apple Watch that a person wears all the time, and they are passively monitoring things that the person does in vital signs. There's also a class of devices that are ambient, so you can think of sensors that exist in, say, like a hospital bed or monitor a room. And they either take medical readings or vital signs or report on patient behavior. And then there's a class of devices that can be used. So there'd be like injectables, pills, and things like that. So what are some of the key scenarios? So we see them as kind of three pillars. The first would be patient monitoring. So where we use sensors and PROs, which stand for patient reported outcomes, which are surveys that a patient will fill out to add subjective feedback to any of the sensor data. And this is valuable in a lot of remote care, telehealth, and chronic disease management scenarios. Another pillar that we see is in research and life sciences, specifically around clinical trials and lab data analytics. And then third, there's a whole category of smart hospitals. We're not going to really focus on that for this presentation, but just want to make it aware that it's out there. Another thing to call out is the use of IoT and IoMT devices within healthcare is growing rapidly. It's projected to reach $340 billion by the end of 2025. So it's a very exciting and growing space. So with that brief introduction, what are some of the challenges of implementing an IoMT solution? So if you're going to be building your own IoMT solution, there's several things that you may need to account for. The first is ingestion of high frequency data. Not all devices are high frequency. Some of them may only be reading, once a day, but there's also a lot that can produce data at very high rates, every second or sub-second. So if you want to be able to interact with that class of devices, you would need to account for that. You also have a desire or attention for low latency. So you want to be able to get or ingest the data and make it available as soon as possible as you can. You also have to associate data from the device to a patient record to make it meaningful. There's also a multitude of devices out in the ecosystem. There's not a lot of standardization out there, and they all report data in their own unique way. Another key thing that you would need to account for is interoperability, specifically within the healthcare data realm. And specifically here, this is where we're targeting FHIR, which is a open healthcare standard that's gaining traction in the community and provides us a way of sharing data across hospital systems. You also have to be aware of privacy and security and account for those. And also, what do you do when you need to update the data that's coming from the device? So with those key points gone through, what are some of the challenges that you'll encounter, especially if you're building your own solution? So one of the key ones is late arriving data, especially if you have a wearable device that's using some kind of gateway for internet connection. like a smartphone. You can have data that's being collected, for hours or even days at a time, and then once internet connectivity is established, that data will all be sent and transmitted. So you need to be able to be able to handle that burst of data, and then make sense of it appropriately and associate with the right time period. Similarly to that, there's really no standard in how the device may send data. So if it's been offline, it may send the most recent data first and work back chronologically, or it could send out the oldest data, and there's really no particular order. So whatever solution you have would need to account for that. There's also the problem of duplicates, because the device itself may choose to resend data because it was in the middle of transmitting, connection was lost, and it didn't get the acknowledgement that a particular piece of data was successfully received. You have to be able to handle linking the data to the patient. And there's this tension between balancing latency and load on the system. So, like I mentioned earlier, you want to get the data available as quickly as possible. But if you go with near real-time or real-time processing, that adds significant challenges on the back end. There's also, as I mentioned earlier, there's devices that run the gamut of how they send or represent their data streams. There's really no clear standardization. And this particular last one is managing the number of resources created in FHIR. So the resources, you can think of them as like entities. Specifically in FHIR, we call them observations when we're dealing with health data specific to a patient. So you can imagine is if I have a device that's streaming health or heart rate data every second, and I'm creating a distinct observation for each of those, that can present some challenges in how to enumerate or retrieve that data. Because even pulling back like a patient's days worth of data presents several thousands of records. So we've had through the years several prototypes and partners that we've been working with as we've tried to come up with solutions, and wanted to go over some of the lessons learned and kind of what we have used as guiding principles when we built our solution. So one of the things, as I just alluded to in the last slide, is that a single value observations are not sufficient. So we don't want to just store or have only the option of storing that heart rate data as a single point. Thankfully, FHIR does have a time series format called sample data that allows us to essentially group collections of data into a time series format. So one of the things that we do here is you define an observation that, say, could be for an hour, and then every single measurement within that hour for that, say, heart rate would be represented within that observation. When we're looking at prototypes or how we might tackle this problem, one of the first places we went to was on the device itself. Is what could we put on the device? How could we standardize and have basically some code that would run on the device that would handle the recording of the measurements and sending them to the cloud. That presented several challenges, and we opted to actually try to make the solution device agnostic and essentially allow us to receive the data in any way possible on the cloud side and reconcile it there. Some of the problems are, device complexity. They run in the gamut of some have a lot of processing power, some have very little. And also, if you're doing all the processing on the device itself, that inherently introduces latency. The device manufacturer or the person that writes the gateway, may have a buffering period, which is fine if that's what they choose to implement. But we didn't want to have an inherent solution that had latency built in. And then code portability. Each device runs on its own particular OS or firmware version. So making a one-size-fits-all solution that lived on the device was problematic. Another thing is FHIR is an evolving standard, and one of the things we didn't want to do is if we were doing the conversion and collection into FHIR on the device itself, then we have to ensure that, if we want to upgrade the version of FHIR, that then we have to make sure all the devices are upgraded as well, where if we do that in the cloud, we can kind of decouple those things. The other interesting tension point is specifically when we get into these value sample data time series formats, the FHIR payloads themselves can be very large, and we wanted to kind of keep the footprint to a very small size because some of these devices, are very tiny. So that brings us to kind of two solutions that we've built. So we have both an OSS version, the IMT Fire Connector for Azure, and a PaaS option currently in public preview, the Azure IoT Connector for Fire. The IMT Fire Connector for Azure allows you full control over the code. So if you want to take the basic building blocks and then extend it or add enhancements to support your specific scenario, you're free to do that. But if you'd like to have a one-stop shop and use the solution that we built as is, then I encourage you to look at the Azure IoT Connector for Fire. So what is the IMT Fire Connector for Azure? So we provide an endpoint that can process high-frequency IMT data, process payloads with mixed data types, and we accomplish this by first normalizing data. So we take data that's in a non-FHIR format and merge it into a common intermediate format. Then we group that data by various properties, and then we do the transform step where we convert it into FHIR observations. And finally, it's persisted in the target FHIR server. So we're going to go through these steps a little bit in more detail to kind of highlight what's going on there. So in the normalization step, we take these arbitrary device payloads represented here with, H rate, heart rate, and HR. So think of these as 3 different devices that are sending their own discrete payload to the cloud. With that data, as it's coming in, we'll normalize it into a common model and the output would be based off the simple example, heart rate 65, heart rate 59, heart rate 88. Another important thing that we do in normalization is projection. So a lot of times devices will send up essentially one message with various attributes for different vital signs. This is great from the device's standpoint because they're usually sampling these at the same frequency, and sending one message is convenient and practical for them. But on the processing side and storage side, a lot of time your heart rate doesn't really have any direct correlation to your steps or your heart rate variability, and you'd want to store them in separate observations in FHIR. So to accomplish that, our normalization step also supports projection. So you can configure it such that these would get split out, and then conversely, they could be stored as separate observations in FHIR once we get to that step. In the grouping and buffering stage, we have data grouped according to the type. So think of this is like a semantic type that the person configuring the system defines: heart rate, step count, blood pressure, etc. Window time, and device. This essentially controls your end-to-end latency, and is one of the options in the open source that you can tweak that's configurable. It's currently locked into 15 minutes in the public preview, but it's going to be something that we're going to open up as configurable in the future. So this essentially controls how often data is egressed from the connector into FHIR. So if you tweak it lower, you're going to get data into FHIR sooner, but you're potentially going to increase the load on your FHIR server. So depending on your use case, you may want to have it very small because you need to do some real-time analytics, real-time processing, or if you are doing something that's more analytical, you may set a higher value because you want to have the system. It doesn't matter if it's on the minute available on the FHIR server. So finally, the FHIR conversion, we have several options. So you can define the period. So this is if you're using the time series format that I mentioned. So you can say, I want this observation for heart rate to be bucketed by, say, an hour. So every hour, as data is streamed in or uploaded to the connector, we'll figure out what hour time period that data belongs to and merge it into that observation. We also support various coding. So this is where you would define your LOINC, SNOMED, or other code systems for annotating your data. You also can set the data type. This is where if you were using the sample data type for time series I mentioned, or if you have scenarios for string data or value quantity, because the measurements are infrequent, you can configure that there. We handle for you mapping the data to the correct observation based off the time that it was recorded as being observed. And we also make a deterministic identifier. So as data comes in, we can save it. And then if data for that same observation that needs to be amended later, we can identify it and update it accordingly. And then all the observations that we create are linked to both the patient and the device. And for those that are familiar with FHIR, we support not just single value observations, but there's a concept of components. An example of this would be you have a blood pressure observation, and you can have components for diastolic and systolic blood pressure. And here's a quick example of FHIR observation that would be created by the connector. So we can have here up like the internal ID and the resource type. We have the device and subject references, which is the patient reference in this case. Coding, so right here we have a LOINC code for heart rate, the effective period, and this one is just a simple value quantity. And real quick, I'm going to go through some of the configuration steps. So one, the normalization step is we have a concept of device mapping. So what this may look like here is I have a sample payload from a device. We have a multitude of different signals that are being recorded and some properties for the date and time that the measurement was recorded and a device ID. Your responsibility for using the system is to configure a template that will know how to identify and match this. So some key pieces here is we have a template that's supposed to map this to a semantic type of heart rate. And then we achieve this by this type match expression here. So basically, if this evaluates to true, then we have identified it as a message of this type, and we'll proceed then to extract the various values defined here. And then the output of this is a normalized value. On the FHIR mapping side, we'll take a collection of normalized data like this, combine it with a template where we're mapping based off of the semantic type that the configure of the system defines, and then use some other properties to say, in this case, we want the period interval. A 0 means it's a single instance, so we're just going to create this as is, the codes we want to associate with it, and then how we extract the values and how we represent them in FHIR. And this would be the output. So with that, you may be wondering exactly how can you use the IoT connector as part of a larger system. So here's a kind of reference architecture how we see the connector being used. So on the left-hand side, we have the ingestion, where we have data coming from devices that can either be using a device gateway, using one of our Azure IoT products like IoT Central or IoT Hub, or going through a phone gateway and connecting to the IoT connector directly. The IoT connector then funnels data into our managed Azure API for FHIR, which is the FHIR server that you can use to access the data that as it's being streamed in. You can also use this to ingest data from EHRs and third parties into the Azure API for FHIR. And once there, you can use it in various applications. Similarly, if you wanted to do analytics, once it's in the Azure API for FHIR, we support export and anonymization, and then you can take it into various Azure services from there. With that, I'm going to hand it over to Nate to go into the demo.
Okay, thanks, Dustin. And thanks everyone for attending. So the demo I'm going to show today is an end-to-end pipeline using the Azure IoT Connector for FHIR. And it was really easy to set up. I mean, it basically didn't require writing any additional code, just configuring the different components. So the first thing I'm going to do is take a minute to walk through some of the components in this demo. I've deployed an instance of Azure API for FHIR, which is what we use for our persistence layer. So Azure API for FHIR meets HIPAA regulatory requirements, and it's also ISO certified, so it can be used to safely and securely store protected health information. Within the Azure API for FHIR control plane, I enabled an Azure IoT connector for FHIR and configured the mappings to process the device data that we're going to be sending. So Dustin talked about those device mappings that are used to transform an arbitrary JSON payload to FHIR, and we'll be taking a deep dive into how this conversion works with data from an actual device. So I have a device here. I'll hold it with my camera. It's an iHealth device made for measuring blood oxygen saturation. It's just an off-the-shelf device. I think it was about 40 bucks. And I'm also, if you look to the right side of my screen, I'm projecting my iPhone. And you can see I installed the iHealth app. It's the orange icon labeled iHealth. And when I take a measurement using this device, the iHealth app will write the blood oxygen saturation measurement to the HealthKit. So I just want to take a minute to talk about HealthKit. HealthKit is available on all iPhones. It's developed by Apple and built into the OS. And applications and devices can store health data on the iPhone using HealthKit. And this data can be shared securely with third-party applications if and when a user grants permission to share the data. So our team leveraged this capability and developed an open source Swift library called HealthKit on FHIR. So HealthKit on FHIR exports data from HealthKit automatically to the IoT connector. This library is available on GitHub, along with documentation, a quick start guide, and a sample app that can be deployed in an iPhone for testing and evaluation. And for this demo, you can see that I deployed the sample app. It's the white app icon labeled IoT Fire. And pre-demo, I configured the IoT connector endpoint so it would send data to an IoT connector that I created. And also, I created a patient in the Azure API for FHIR that represents me. Now, when the iHealth application saves a blood oxygen saturation measurement to HealthKit, it's immediately exported to the IoT connector, processed, and saved as an observation resource into the Azure API for FHIR. So once the data is there, we can then use the Power BI Fire Connector to create a report. And here's what that report looks like. So I created a kind of a quick and dirty dashboard that simulates a scenario where a clinician is monitoring blood oxygen saturation for a group of patients. This first page shows the measurements taken today, and I'm down at the bottom. My row is highlighted yellow. Yellow means that the measurement has not been taken for today, and highlighted red means that the measurement is under 95%, as is the case with Grace Owens here. So I do want to call out, with the exception to myself, all of the patients on this list are fictitious and their data is all synthetic. So let's take a quick measurement and see what happens here. So the first thing I need to do is I need to launch the iHealth application. So I'll launch that, and then I turn on the device that reads blood oxygen saturation. And so when it connects to Bluetooth, what happens is the phone starts reading data, and when I take the device off my finger, it's going to create a single blood oxygen saturation measurement that's going to be written into HealthKit. So I pulled that off. It says 98%. My pulse rate is 128. That's pretty high. So The Health Kit on Fire app sees the new data immediately and uploads it to the IoT connector. And this is where the normalization process begins. It extracts the device identifier, the time the measurement occurred, and the measurement data itself. At this point, I'm going to take a minute to go under the hood and see how this data is being processed. So this is what the payload from Health Kit on Fire looks like. The measurement is here at the top. The timestamp and device ID are here. And Dustin briefly talked about the two mapping files that help transform arbitrary JSON payload into FHIR. On the right is an example of the first mapping used to normalize JSON data into the format that's easier for the IoT connector to work with. So we use this JSON path expression to determine if this mapping should be applied to the incoming payload. And we see that there's a match, so we can start extracting the other values that we're going to use to create the FHIR observation. We use the timestamp expression to locate and extract the timestamp, so we know the date and time the measurement took place. We use the device ID expression to locate and extract the device ID, so we can provide a reference in the observation resource to the device that generated the measurement. And then we use the value expression to extract the measurement value. Once all the values have been extracted, we create a normalized data object that is used internally by the IoT connector. And this gives us the ability to accept JSON payloads from many different devices that may have many different data formats. So now that the incoming data has been normalized, we could group the data if needed. In this example, we don't need to because it's a single measurement, but grouping is useful if the data is expected to be streaming or high frequency. And it's useful because we can, as Dustin mentioned earlier, we can limit the number of observations that are created. So now we take the normalized data and we create a FHIR observation. So I'm going to jump in and show how that's done. So this is the example of the second mapping JSON, the FHIR mapping. The FHIR mapping also uses JSON path to locate and extract data. So the first thing we do is check if this FHIR mapping should be applied to the normalized data that was created in the first transformation step. This FHIR mapping should be applied to the oxygen saturation type. And we can see that this normalized data is of type oxygen saturation. And because the normalized data type matches, we can start the process of creating an observation. So we establish the value type that will be included in the observation. And as you can see, this observation will contain a value quantity. So value quantity can be used for single measurements like what we're showing in this demo, but there are other types. I think Dustin mentioned about valued sample data. Those can be used for streaming, and then string values and also codable types. So we support more than just quantity types. So we locate the value by name in the normalized data, in this case, oxygen saturation, and then we write it to the observation resource. And as you can see, because the observation value is a quantity, the value is converted from a string to a number. If this normalized payload though contained a number, it would just write the number as is. So then we copy the system, unit, and code from the FHIR mapping to the observation so that the value is coded properly. And then any of the codes in the template are copied to the observation. Here we just have the one code, but you can add as many codes that are required to support your business case. And then we write the time that the measurement was taken. So we use that timestamp to create an effective period start and end. Because it's a single measurement, the start and end are exactly the same. Okay, then the last step in creating this observation is setting the references to the patient that took the measurement and the device, that the measurement was taken from, and the device that took the measurement. So this is done by fetching the device resource using the device ID from the Azure API for FHIR. Now the Health Kit on FHIR application, or the Health Kit on FHIR sample application, will actually create devices for you in FHIR, and that way the data that comes in at a later date will be linked to it. So the FHIR ID is then copied from the observation as a reference, and the patient reference that's been taken included in the device resource is copied to the observation. So I want to call this out specifically. The IoT connector in this instance has been configured to look up the device and a patient when the data arrives. So this means there's an expectation that a device resource with a matching identifier exists and that device resource has a reference to the patient resource. The IoT connector can also be configured to create device and patient resources automatically when data is sent to the connector, and that's just by configuring it to do create. So now that the observation has been created, we can persist the data in FHIR. Okay, so now we have 3 resource types in Azure API for FHIR. We have the patient resource, which represents me, the device resource, which the health kit on FHIR sample app created, and then an observation, which was created based off of the data generated from this blood oxygen saturation monitor. For this demo, we're just going to import the 2 types to Power BI to generate our report. It's going to be patient and observation. And then we can shape this data. In this case, I'm going to merge the list of observations to the patients that they belong to, and that way I can chart the measurements over time. And then once that data's been shaped, I can create my visualizations. So let's jump back to the dashboard and we can see what it looks like. So I'll refresh this really quick. It might take a little bit of time because I have several hundred observations now, and then I think we have 10 patients. Once the data is done refreshing, it should update the UI, and you can see that the 98% value, let's make sure that's correct. Yep, 98% from the iHealth application is properly reflected here. I can also go through and drill through, so I can look at these other measurements that I've been taking since the, what is this, the 18th of October. And so this just maps out all of my daily measurements that I've taken. There was a couple low spots in here, but for the most part, my trend line is going the right direction. It's going up, so that's good. And if we go back to the first dashboard here, we can actually drill into Grace Owens and we can see what's happening here. So here, Grace Owens, again, my fictitious patient. Her last measurement was 91. And it does seem like the trend line seems like she's trending down. So it might be time to give her a call and have her come into the clinic. Okay, so I did want to leave you guys with some links to some of the tools that we use today. Again, this was a no-code solution. I just literally deployed the sample application on the health kit on FHIR repository. I set up the Power BI Fire Connector, which is generally available, and also created an instance of Azure IoT Connector for FHIR along with the FHIR server. And so here's some links to the documentation.
Okay, thank you, everyone. If you have questions, our contact information was at the beginning of the presentation, so feel free to reach out to us directly if you have further questions. Thank you. I hope everyone has a great day.